Straight Shot.
Welcome to Straight Shot. I'm Dr. Clete Barrick, dual board certified in internal medicine and obesity medicine. I've treated thousands of patients on GLP-1 medications, peptides, and medical weight loss therapy. This is Straight Shot, the science of weight loss, explained by a doctor who lives it. Quick note, everything on this show is for education only. It is not medical advice for your specific situation. Always talk to your prescribing physician before making any changes to your treatment plan. Welcome to Straight Shot. Here's something most doctors will never tell you. I take the same medication I prescribe. I'm a board-certified obesity medicine physician and treated thousands of patients on GLP-1 medications, and I've personally lost over 80 pounds on tirzepatide. I rotate my injection sites, manage the nausea, watched my body change in ways that years of disciplined exercise and careful eating never achieved on their own. That's not the confession. The confession is this: I was an obesity medicine doctor who was obese. And I'm not ashamed of that, because the fact that I couldn't do it on willpower alone is the entire point. This is the show where I give you the GLP-1 information your doctor doesn't have the time to explain from a physician who's been on both sides of the prescription pad. This is episode 1, and today I'm going to tell you who I am and why this show exists. I want to be honest with you about something before we go any further. There are a lot of people making content about GLP-1 medications right now. Influencers, dietitians, coaches, other physicians. Some of it is good. A lot of it is terrible. And almost none of it comes from someone who can say all three of these things at once. So I'm a dual board certified physician in internal medicine and obesity medicine. I've treated thousands of patients on these medications going on 5 years now, and I take the medication myself. That combination matters because it means I can read the clinical trial data and tell you what 3 a.m. nausea actually feels like. I can explain the pharmacology and tell you about the first time I drove past a fast food restaurant and felt absolutely nothing, which is completely life-changing, by the way. This was my Achilles heel. I know what the STEP trials say about average weight loss, and I know that my experience, your experience, every patient's experience is not an average. It's an N of 1. I wrote an entire book about this. It's called The GLP-1 Bible. Over 250,000 words, 800 plus references, 44 chapters. And I realized that most of the people who need this information are unlikely to read all of a book that size. They need someone to take the time and break it down. And that's what this show is. I earned my medical degree from the University of Washington, and I completed my residency with the Navy in Virginia. I spent 8 years as an active duty naval officer, including 2 years with the Marines in Okinawa, Japan. I worked alongside some of the fittest people on the planet, Marines who could ruck for miles in body armor, do pull-ups until the bar bent, and operate on no sleep in some of the hardest conditions imaginable. And I was heavy the entire time. Not a little extra. I mean, I was heavy. I was the doc who would, counsel patients on nutrition and exercise with genuine expertise, who understood the science in and out, and who still could not get his own weight under control. It sucked. I tried everything, and I don't mean that casually. I mean calorie counting, macro tracking, intermittent fasting, keto, structured exercise programs that I designed myself because I literally have the credentials to do it. I could get the results for a while. I could lose, 20, 30 pounds, but then my body would inevitably fight me every inch of the way back up. The reason I'm telling you this is not for sympathy. I still mentally struggle with this saga of my life. I'll admit it was embarrassing, and even knowing the science, I still feel a level of shame about this. It's something that I'm working on still. I share this because if it sounds familiar to you, I want you to hear it from a physician. You are not failing. Your biology is working against you. Obesity is a chronic relapsing disease driven by genetics, hormones, and neurochemistry. It is not a moral failure. The American Medical Association recognized this in 2013. The Endocrine Society agrees. The World Health Organization agrees as well. your body has an internal thermostat, a set point that it defends. And when you lose weight through diet and exercise alone, your body fights back to get to that set point again. I knew all of this. I taught it to patients. I believed it, and I still blamed myself. So then I started tirzepatide, and a few weeks in, something changed that I was not prepared for, even, with all of my training. That was the food noise stopping. If you've experienced this, you know exactly what I'm talking about. That constant background hum of thinking about food, planning the next meal, negotiating with yourself about whether to eat the thing or not eat the thing. At least 10% of my internal RAM seemed like it was always dedicated to food, always. For me, it had been there so long, I didn't know really that it was there. It was like living next to a highway and forgetting the traffic noise until someone actually closes the window. The medication closed that window. Now, I've lost over 80 pounds, and I'm in maintenance phase at this point. I'm healthier now than I've been my entire life. Now, here's the other side. I don't just take this medication. I prescribe it every single day. I've watched a patient buy an entirely new wardrobe for the first time in a decade. I've sat across from someone who told me they went to the beach without feeling self-conscious for the first time since their teens. I've had a grandmother describe riding a roller coaster with her grandchildren because she could finally fit in the seat. That one was particularly cool. I've had a patient call me, say she, boarded a flight without asking for a seatbelt extender for the first time in her adult life. I mean, how amazing is that? These medications give people the chance to become the person they've been working to become their entire lives. And from the first day I started caring for these patients, I haven't felt like I've worked a single day. But I've also seen the other side. I've seen patients come to me after being mismanaged, undertreated, overtreated, scared by bad information, or honestly neglected. I see patients who were told they were maxed out on semaglutide and they had never been offered tirzepatide. I see patients whose providers escalate their dose on a rigid monthly schedule from the FDA titration charts because they don't know that there's a far better way to do things. I see patients who develop thyroid problems because nobody told them that semaglutide can change how their thyroid medication is absorbed. I see patients who lose hair, lose energy, lose muscle. The list goes on and on. And I've seen far too many patients too who believe, who've been told GLP medications don't work for them, when the medication really is working perfectly. It's the care that has failed. I'll say a patient I'll call Kevin came to me after about 7 months on semaglutide. He lost about 14% of his body weight, a very solid result, and then he plateaued. His provider pushed the dose higher. Nausea got worse. Kevin started dreading injection day, pushing it back further and further, and he was up at the highest dose, and the scale still wasn't moving, and he felt absolutely awful. Kevin's medication hadn't failed. His dosing strategy had. So we ended up switching him to tirzepatide, built back up at a pace his body could actually tolerate, really individualize that dosing, and we found his sweet spot. 8 months later, he was down another 9% of his body weight. Never needed the maximum dose, believe it or not, and his A1C dropped from 6.1% to 5.4%. So Kevin's story is not unusual. I'll grant that switching from semaglutide to tirzepatide is not a complex tactic. That's kind of beginner level stuff in my book. And this podcast isn't just going to stop at techniques you can pull off the front page of the Tirs subreddit. We are going to discuss tactics, strategy, biology that your doctor either won't tell you or doesn't even really understand. Here's the uncomfortable truth about GLP-1 medications in 2026. Access has exploded. Telehealth companies, compounding pharmacies, direct-to-consumer platforms. I mean, you can get a GLP-1 prescription from your phone in under 15 minutes, start to finish. That access matters. It matters enormously, and it's honestly pretty cool to see how far the telehealth space has developed over the last few years. And a lot of people who couldn't afford or couldn't reach these medications can. But access without expertise is a recipe for suboptimal outcomes. Many patients on GLP-1s today are being managed by providers who see them, for 5 minutes every couple of months. They run a one-size-fits-all algorithm on their patients without really understanding the clinical nuance. And they honestly just don't have the training or the time to manage the complex interplay of dosing, nutrition, exercise, sleep, stress, drug interactions, and psychology. It all determines whether a patient gets a decent result or an extraordinary one. I'm not pointing fingers. The demand for these medications outstripped the supply of trained obesity medicine physicians years ago. There aren't enough of us, and most primary care doctors got maybe a couple hours of obesity medicine training in medical school, if that. So patients fill the gap the way modern humans fill every knowledge gap. They go to Google, they go to Reddit, they hop on TikTok. They find a mix of genuinely helpful patient experiences, dangerous misinformation, and everything in between. A research team analyzed over almost 400,000 Reddit posts related to GLP-1 medications. They found that patient-to-patient comparison was by far the most common topic. People trying to figure out if their experience is normal, using other people's anecdotes as their benchmark. That's where I come in. Before we keep going, I want to tell you about something I built for exactly this problem. Barrick Health is my concierge telehealth practice. It exists because I got tired of watching patients get 5-minute appointments, a prescription, and a see in a few months. That's not care. That's a vending machine. At Barrick Health, I work with patients one-on-one, real appointments, real time. We go through your labs, your medications, your nutrition, your exercise, your sleep, every variable that affects your results. I build a plan around your body, not a soulless algorithm. If you've been on a GLP-1 and feel like something is off, if you've been told you're maxed out and you don't know what's next, if you want a physician who takes these medications themselves and treats thousands of patients on them, check out www.barrickhealth.com. I'll put the link in the show notes. Now, back to the show. Every week on Straight Shot, I'm going to sit down and give you one focused topic. No guests, no panels, no fluff, just me, the evidence and the clinical experience I've accumulated over years of eating, sleeping, and breathing GLP-1s, as well as my own personal journey. We're going to cover how these medications actually work. We're going to talk about side effects, common ones, weird ones, and the ones nobody warns you about. I'm going to give you my complete dosing playbook, the same framework I use with my own patients. We'll talk about what to eat, how to exercise, why sleep matters more than you think, and what happens to your brain when the food noise goes quiet. We'll talk about stuff nobody else talks about. The emotional side of losing weight, what happens to your relationships, the identity crisis nobody really gives you the heads up about, alcohol cravings that disappear, the insurance denial you shouldn't accept. And I'm going to tell you about the future. Retatrutide, CagriSema, oral GLP-1 pills, and what the next 5 years is going to look like for this field. I'm going to be honest with you on this show. When the evidence is strong, I'm going to tell you. When it's uncertain, I'll tell you that too. I'm not going to hedge everything into oblivion and give you a watered-down, liability-proof version that sounds like was written by a hospital legal department. So you deserve better than that. You deserve a doctor who tells you what he actually tells his patients. And that's what straight shot means. No chaser. Here's what I actually tell my patients on day one. You are not lazy. You are not weak. You did not fail at dieting because of a character flaw. You have a chronic disease with genetic, hormonal, and a neurological basis, and you now have access to the most effective treatment that has ever existed for it. But the medication is not a magic shot. It's a tool. It's the best tool we've ever had by far, and like any tool, it works better when someone who knows what they're doing helps you use it. And that's what I'm here for. If you're just starting, if you're stuck, if you're scared, if you're confused, if you've been told the medication stopped working and you don't know what to do next, you're in the right place. And if you don't just want education, if you want a physician who will actually sit with you, go through your numbers, build a plan that fits your life, that's Barrick Health. Concierge telehealth, real appointments, a doctor who's been where you are. So that's the first episode of Straight Shot. Next week, we're getting into the science, how GLP-1 medications actually work in your body, explained in a way that makes sense without a medical degree. If this was helpful, subscribe so you don't miss it. Share it with someone you know who's on a GLP-1 medication or thinking about starting one. I'm Dr. Clete Barrick. Thanks for being here. I'll see you next week.